Urology as a subject has undergone sea change, almost a revolution in the kind of science we perceive and read and practice today. The kind of subject which has encompassed congenital, adolescent, adult, geriatric, and epidemiological aspects in urology. The kind of medicines which have come in, the kind of research which is happening, the kind of motivation in the subject, though it may be deep down in the alphabetical order, has undergone a sea change. And therefore, it's time to bring urology health to the front row seat for the society. It is also important to shatter myths in urology, or which surrounds and probably what mankind thinks about it. So the society today needs to understand that there are these myths which need not be taken forward in understanding of the subject. मित्रों, आज हम उन मिथ्स और उन मिथ्याओं को शैटर करना चाहते हैं जो यूरोलॉजी में बिल्कुल घर बना गई है। उन चीजों को जिसको हम भूलना चाहते हैं, जिसके बारे में उतनी दकियानसी ख्यालें हैं, इस सब्जेक्ट में जो रिवोल्यूशनाइज कर रहा है आज पूरी हेल्थ केयर को। तो समझते हैं उन सारे इंपॉर्टेंट मिथ्स को, जो ये 14 मिथ्स जो हमने आपके लिए बनाए हैं। The first myth is everyone is born with 2 kidneys. ऐसा माना जाता है कि हम दोनों में, हम सब लोगों में 2 किडनीज है, पर ऐसा सच नहीं है। अगर देखा जाए तो 1 in 4,000 individual is born with only 1 kidney. In other words, 1 in 4,000 individual is born with a solitary renal agenesis. Solitary is single, renal is kidney, agenesis is absence. So solitary renal agenesis or absence of 1 kidney is a known fact. It is something with which you could be born. What does it denote? It denotes that you could be doing well with only 1 kidney. You have been given a surplus kidney, that means you've got 2 kidneys, but what kidney is good enough for you? That's later on discussed in another myth, so we'll go to that enough. So friends, everyone is not born with 2 kidneys. 1 in 4,000 individual is born with 1 kidneys. And I get to see perhaps 1 to 2 patients every month who come in here either incidentally picked up on a health checkup or come here for an emergency consultation saying that, doctor, I have an emergency ultrasound report which shows I have only 1 kidney. And when we look at it, they were born with only 1 kidney. So with 1 kidney, you can sustain yourself well. And that is the motto and understanding that if you got 2 kidneys, 1 kidney can be donated in a kidney transplantation for a life-related kidney transplantation for your relatives. So मित्रों, हर किसी के पास 2 किडनी नहीं होता है। जन्म से बहुत बार एक ही किडनी हो सकती है और एक किडनी से जिंदा रहना पॉसिबल है। ये बहुत इंपॉर्टेंट मिथ है जिसे हम शैटर करना चाहते थे कि एवरीवन इज बोर्न विद 2 किडनीज, व्हिच मे नॉट बी ट्रू। हम अगले मिथ को जाते हैं, मिथ नंबर 2। उससे पहले ये देखा जाए तो सिर्फ हम आपको एक ही किडनी दिखा रहे हैं जो राइट साइड की किडनी है, और यहाँ हम आपको दिखा रहे हैं सरप्लस किडनी जहाँ 3 किडनी है। तो नॉर्मली लोगों में 2 ही किडनी होता है, पर यहाँ हम देखने की कोशिश कर रहे हैं कि कभी एक किडनी से भी काम चल रहा है। ये एक एडल्ट पेशेंट है आपके लेफ्ट साइड में, और यहाँ राइट साइड में आपके पास एक पेशेंट है जिनकी 3 किडनीज है, सुपर न्यूमरी किडनी। तो ये पॉसिबल है कि एक किडनी या 3 किडनी भी हो सकते हैं, पर नॉर्मल लोगों में 95% to 99% लोगों में 2 किडनीज होते हैं, और दोनों किडनीज अपना काम करती हैं। वो वेस्ट प्रोडक्ट निकालती है और तरह से ब्लड को प्यूरिफाई करती है, और वो करते वक्त सारा वेस्ट प्रोडक्ट निकालती है तरल पदार्थ में। एंड देयर इज अ पॉसिबिलिटी दैट इफ there's a high amount of solutes or supersaturation of urine with these solutes, but not good amount of liquids or water intake, possibility of supersaturation of urine and stone formation could be a common denominator. Let's go to myth number 2, which is almost a fallout of myth number 1. Donating 1 kidney to a relative for kidney transplantation would endanger life. ऐसा सच नहीं है. It is not true that if you donate a kidney to your relative for a life-related kidney transplantation, आपकी बदन को कोई खतरा है. In fact, आप बहुत सेफ हो जाते हैं, because medical community आपको as a donor बहुत respect करती है, not only for the altruism but also for the kind of respect you have for your fellow colleague, which is your own relative in a life-related kidney transplantation under the laws of the HOTA Act. But you are followed very closely with the medical community. So the answer is, donating a kidney in life-related kidney transplantation is done after evaluating that the better kidney stays with the donor. तो अगर आप डोनर हैं और आपके पास 2 किडनी है, तो आपकी जो अच्छी किडनी है वो आपके साथ रहती है, जो लेसर फंक्शनिंग किडनी है दैट गोज टू द रिलेटिव और टू द रिसिपिएंट। इसे क्या समझाना होगा? अगर हमारे पास 2 किडनीज हैं, कोई जरूरी नहीं है दोनों 50-50% काम कर रहे हैं। एक 55% काम कर रही होगी, दूसरी 45% काम कर रही होगी, एक 60% काम कर रही होगी, दूसरी 40% काम कर रही होगी। तो ऐसा पॉसिबल है कि जो 40% काम कर रही है वो आपके रिलेटिव या किडनी ट्रांसप्लांटेशन को जाती है, और 60% काम करती है या जो 55% और 45% में 55% वाली आपके साथ रहती है। तो ये देखा जाए कि जो किडनी अच्छा काम कर रही है वो हम आपके पास छोड़ देते हैं ताकि आपको कोई खतरा ना हो। In other words, donating one kidney to a relative for kidney transplantation never endangers life. You are an important individual. The medical community, the nephro and the urology team will take care of you by watching you yearly thereafter to see that you are continued to be doing well, while you've done a great job by helping out a relative who underwent a live relative kidney transplantation and continues to do it with you. In other words, the society needs to know that live relative kidney transplantation in a country like India, where there's always the dearth of the number of cadaveric transplants which we can do, it's important for the family members to understand that while we share our everything with our relatives, it's also important to share our kidneys or our organs and be an organ donor in life to your own relative who's tied to the machine for a dialysis week after week, month after month. Myth number 3. Kidney is not affected by diabetes mellitus or by blood pressure या hypertension. That's not true. ऐसा सच नहीं है कि किडनी को डायबिटीज और ब्लड प्रेशर की चोट नहीं पहुंचती है। याद रखिएगा, किडनी इज डायरेक्टली अफेक्टेड बाय बोथ द कंट्रोल एज वेल एज द नंबर ऑफ इयर्स ऑफ बोथ डायबिटीज एंड हाइपरटेंशन। इन अदर वर्ड्स, अगर बहुत सालों से डायबिटीज है और बहुत सालों से ब्लड प्रेशर की शिकायत है और वो कंट्रोल में नहीं रह रहा है या कंट्रोल में रह रहा है, तो भी किडनी को चोट पहुंच सकती है। The commonest cause of kidney failure across the world, which is called as end-stage renal disease, are normally uncontrolled and long-standing diabetes and long-standing hypertension. तो ये बहुत जरूरी है आपको जानना कि kidney is affected by diabetes, kidney is affected by hypertension, and therefore the two common epidemiological phenomena in today's modern stressful life, diabetes and blood pressure, needs to be maintained. Be stress-free. Look at prevention of diabetes and blood pressure, or at least controlling them a lot by your own lifestyle changes, because these are lifestyle diseases. Taking care of them by seeing your physicians, your endocrinologist and your nephrologist, and keeping them in complete check. And while you do so, your age changes, your body undergoes a change, and still on long-standing diabetes and long-standing hypertension, on uncontrolled diabetes and hypertension, the kidney gets hammered, injured very gradually. धीरे धीरे ये किडनी को शनह शनह चोट पहुंचती है, और इसे देखा जाता है कि 10-20 साल की डायबिटीज के बाद, 10-20 साल की हाइपरटेंशन के बाद बहुत शनह शनह ये चोट पहुंच रहा है, जहां आपकी डायबिटीज और ब्लड प्रेशर ने आपकी किडनी को चोट पहुंचा है, जिसके हम CKD कहते हैं, क्रोनिक किडनी डिजीज। वो अगर प्रोग्रेस करता है और हम इस स्टेप को हॉल्ट नहीं करते और रिवर्स नहीं कर पाते, तो फिर ये एंड स्टेज रीनल डिजीज में चली जाती है, जहां पे दोनों किडनीज इफेक्ट होते हैं, और फिर उसका ट्रीटमेंट डायलिसिस नहीं होता, उसका ट्रीटमेंट सिर्फ ट्रांसप्लांट होता है। तो बहुत जरूरी है कि वी नीड टू आइडेंटिफाई द डायबिटीज एंड ब्लड प्रेशर व्हिच वी समटाइम्स टेक लाइटली इन द सोसाइटी, व्हिच नीड्स अ कंप्लीट therapy and cure and balance of it all their life, needs to be looked at very clearly, because the end organ damage in kidney will happen at a point in time when you are elderly and geriatric, when you may not have that effect and not the wherewithal to reverse back what actually has happened to you as a result of uncontrolled and long-standing diabetes and blood pressure. So myth number 3 is that kidney is not affected by diabetes is not true. It's affected by diabetes and blood pressure. So let's wake up to this phenomena, something which I see so frequently. Diabetes as a disease affects the erectile function, affects the urinary bladder, the contraction powers, the eyes, the kidneys, and therefore it has got a gradual silent change to many organs very silently. Wake up to diabetes control, wake up to diabetes therapy, and wake up not to probably ignore your diabetes, please. Myth number 4. Urologists and nephrologists deal with kidney only. That's not true. Urologists and nephrologists could be brothers in arms who are looking forward to a composite care of your kidneys and your organs. But there's a little difference, which is a subtle difference that you know, but there's a huge difference between urologists and nephrologists. Because many a times you will end up seeing your nephrologist with kidney stones, which is not required. You will end up seeing a urologist with CKD and ESRD, which is not required. So let's open up this subject. Urologist और nephrologist दो अलग तरह के specialized doctor होते हैं. Urologists are specialists who deal with medical and surgical diseases of organs of genitourinary system, starting all the way from adrenal glands to the kidneys on both sides, to the ureters or the pipes which drain urine, to the urinary bladder, to the prostate in men, to the urethra, which is the conduit through which urine comes out to the exterior, and to the sexual organs, which are called the genital organs. So urologist deals with not only the kidneys, but all the organs beyond the kidneys, where the medical and surgical diseases which can happen are dealt by him. In other words, he would deal with kidney cancers, he would deal with kidney stones, He would deal with ureteric strictures. He would deal with urethritis. He would deal with bladder cancers. He would deal with cystitis. He would deal with Peyronie's disease. He would deal with sexual dysfunction. He will deal with testicular problems like testicular cancers and torsion of testis. And he will deal with urethra or urethral stricture. So a huge amount of work which urologist deals with, A to Z. That's a massive subject. Whereas nephrologists are specialists who deal with the medical diseases of the nephron. Now, what is nephron? Nephron is where from which nephrologist word arises. Nephron is the basic unit of the kidney, 1.5 million nephrons on both sides, which actually are the building blocks of the kidney. And their injury and their damage brings about a chronic kidney disease and later on an end-stage renal disease, which I talked to you in the past, myth, diabetes and blood pressure, which are hammering the nephrons. So the nephrologist deals with chronic kidney disease, kidney failure, and sometimes with inflammations of the kidney. But urinary tract infection, it deals with a urologist. He would like to look at identifying a urinary tract infection, identifying the cause of recurrent urinary tract infection, which is either a tight phimosis, either a tight stricture, which is either a bladder outflow obstruction, or is it a hypocontractile bladder which does not empty and pass urine out, or is it a diabetes-related inflammation, or an acquired kind of a phimosis happening as a result of recurrent balanoprosthetis in an adult diabetic. So there are so many things which a urologist deals with. And therefore, as a urologist sitting at the Kokilaben Dhirubhai Ambani Hospital, on one side dealing with adrenal, the kidneys, the ureters, the urinary bladder, the prostate, the urethra, and the external genitalia, which includes the testis and the penile organ in men, and the introitus and the vaginal area in women, is such an important dealing which we do A to Z every day, Monday to Saturday. And therefore, all urinary organs and genital organs where you have got medical complaints around, don't wait and sit on it. Get it sorted out, get it treated, get it identified. And therefore, you got specialists like urologists and nephrologists dealing with two different aspects of the kidney. For example, if you have a stone disease, if you have a kidney cancer, if you are bleeding in the urine, if you have got a kind of a situation where you have got a hydronephrosis, the urologist would look at the causes, look at the treatment, and look at the cure of you. Whereas if you have got end-stage renal disease, if you have got inflammation in the kidney or pyelonephritis, your nephrologist will look into it and probably deal with it in conjunction with your urologist. So friends, we move forward to myth number 5. The bigger the prostate, more the obstruction to the flow. And that's a myth. The bigger the prostate, more the obstruction to the flow may not be right. Because the size of prostate does not have a direct correlation with the obstructive urinary complaints. What does it mean? The prostate harbors the urinary passage or the urethra. And the changes in the prostate, which happen as a result of hormone-related changes that happens from 40s, 50s, beyond an adult life, brings about an internal growth to the prostate, apart from the size that you measure on the ultrasound during health checkups or otherwise and feel a little worried and anxious about. The urethral occlusion is by the internal growth of the prostate, which brings about an obstruction to the urinary passage, and therefore the complaints of obstruction to the flow of urine by adult men. Adult men complain about poor stream, not passing with a good speed. It doesn't go to the wall like the way I used to pass. The passage is very thin and the stream is very narrow, and I don't empty my bladder completely. All this is not related to the prostate size. This is related to the urinary passage being gradually choked as a result of the urinary passage going through the urethra. The urethra is an organ which starts from the bladder neck and it is harbored in the early part in the prostate. So prostate is the one which encompasses the urethra, and as a result of which the urinary passage can get choked because the prostate is gradually enlarging. Friends, prostate वो मेल ग्लैंड है जो 40s 50s में हार्मोन रिलेटेड चेंजेस के थ्रू आहत होता है. ऐसे कंडीशन में प्रोस्टेट जिसके बीच से यूरिनरी पैसेज जा रही है वो रास्ते को अंदर से ब्लॉक कर सकता है. तो आपकी प्रोस्टेट 15, 20, 25 ग्राम की हो या 150, 200 ग्राम की हो, वो साइज इतना इंपॉर्टेंट नहीं है जितना यूरिनरी पैसेज के अंदर के रास्ते की रुकावट है. और रास्ते का रुकावट साइज से भिन्न है. साइज वो है जो एक सोनोलॉजिस्ट आपके लिए मेजर करते हैं और वो एक ऑब्जर्वर डिपेंडेंट टेस्ट है जिसकी दरअसल रुकावट से बहुत खास ताल्लुकात नहीं है. In other words, प्रोस्टेट की जो रुकावट यूरिनरी पैसेज को होती है, वो यूरिनरी पैसेज प्रोस्टेट के बीच से जा रहा होता है, वो अंदर से ब्लॉक कर जाए तो यूरिनरी पैसेज की रुकावट होती है, जिससे यूरिन खुल के ना आता है, रुक रुक के आता है और हमें जोर लगाना पड़ता है और शायद पेशाब पूरा खाली नहीं होता है. और ये शनय शनय दशक बाय दशक बढ़ता ही जाता है. तो 40s 50s से 70s 80s तक हम जाते हैं, हमारी यूरिनरी पैसेज में कुछ चेंज हो रहा होता है, जो चेंज या तो आप पकड़ते हैं और अपने यूरोलॉजिस्ट को टाइम पे बताते हैं, या फिर वो हेल्थ चेकअप में पकड़ी जाती है, या फिर कभी इमरजेंसी में पकड़ी जाती है। सो प्रोस्टेट की साइज और प्रोस्टेट की ऑक्लूजन जो यूरिनरी पैसेज को ब्लॉक कर रहा है, इसमें बहुत डायरेक्ट कोरिलेशन नहीं है। द बिगर द प्रोस्टेट, नॉट नेसेसरली मोर द ऑब्स्ट्रक्शन टू द फ्लो. The more the occlusion of the urinary passage, which is directly complained by the patient or is picked up by uroflowmetry, which I call as ECG of the bladder, where you look at the flow gradually reducing, which is measured by a parameter of the flow patterns in terms of the Qmax, the time to pass urine, the amount of emptying you do, and amount of urine stays back in a real time report card of the examination you give on the uroflowmetry machine is important. Therefore, friends, internal growth and occlusion of the prostatic urethra is what matters, and not the prostatic size alone, because what the obstruction of the urinary flow is brought about by internal change. So be aware of that. Let's not go by the size of prostate. Yes, the larger the prostate, the doctor will look at it and would correlate with its obstruction by your language and by the uroflowmetry, and if required, would obviously look at helping you out if by either giving you medication to shrink the gland by 5 ARIs, or by attempting to operate if it has gone to a level from where medical management is not possible. So let's not sit on the prostate and look at हमारा size हर साल बढ़ता जा रहा है और उसे भी इंतजार कर रहे हैं, हमारी फ्लो कितनी घट रही है वो भी साथ साथ इंपॉर्टेंट है. वेरी इंपॉर्टेंट फॉर अस टू वेक अप टू दिस फिनोमेना व्हेन वी लिव इन अ मिथ. हमारी हर साल की सोनोग्राफी की मेजरमेंट हो रही है और एक चार्ट बना के लेके आते हैं और कहते हैं ये हमारी चार्ट है पिछले 5 साल की, वो हमें फर्क नहीं पड़ता. आपकी पेशाब की फ्लो कितनी खुल के आ रही है, कितना रुक रुक के आ रहा है, वो मैटर करता है, और वो हम यूरोफ्लोमेट्री में स्टडी करते हैं, जो बहुत बार की नहीं जाती है और आप उसे शने शने एडजस्ट करते जाते हैं. कोई भी चेंज जो बहुत ग्रेजुअल होता है, जैसे प्रोस्टेटिक ऑक्लूजन बहुत ग्रेजुअल है, आप उसको एडजस्ट करते जा रहे हैं, एक दिन वो आपको तंग कर सकता है. तो वो बहुत इंपॉर्टेंट एस्पेक्ट है, हमें उसके बारे में जानने की जरूरत है. देखो, प्रोस्टेट की साइज और उसकी ऑब्स्ट्रक्शन को साथ साथ ना जोड़ें. अगर ऑब्स्ट्रक्शन है, पेशाब खुल के नहीं आता है, अपने यूरोलॉजिस्ट को मिले, वो बहुत जरूरी है. Friends, we come to myth number 6. Some people feel that prostate is in the scrotum. ऐसा सच नहीं है. What you feel as the balls or the testes are actually male hormone-related glands which change in size from the time of puberty and grow and bring about changes in the male hormones. So the testes are harbored in the scrotum or the male pouch below the external genitalia, and that is something which is the testis. That's not the prostate. So they are harbored in that the back of the scrotum. Prostate is deep inside. Prostate is just below the bladder neck, and bladder is inside your body, so it's below the bladder neck. And people don't know where the prostate is. So बहुत लोग बोलते हैं हमें पता नहीं prostate कहाँ पे है, and they confuse the prostate to the testis. So testis are two structures, which sometimes can even be one, because one could be missing and could be sitting up. But the testes are the two structures hanging, which bring about the hormones that make you a man and a male. So that's something where your spermatozoa are created. That's somewhere where testosterone is produced for you to have the secondary sexual characters and your maleness. Whereas prostate is deep inside. As a urologist, I would do a finger examination through the rectum and palpate the prostate and look at its properties, identify the prostate in terms of its approximate size, identify the prostatic architecture, its homogeneity, looking at asymmetrical aspect, looking at the hardness of the prostate, looking at suspicious nature of it or softness of it in cases of prostatic abscess or hardness in prostatic cancer, and suspicion brings it to the next level of prostate biopsy. So friends, prostate is deep inside because it's at the level of the bladder neck. It can be palpated by a urologist. So a deep-seated gland at the level of bladder neck surrounding the base of the urinary bladder, and that it grows gradually and would probably in 40s, 50s as it grows could also occlude the urinary passage and tighten the urinary passage, which could be progressive. So wake up to a phenomenon that prostate internally surrounds the urethra through which urine comes out, and the bladder contracts to push urine out. So if the urine is not coming out well, is the prostate to blame or is the urethra to blame? That's the job of a urologist, and therefore let him take charge. Friends, prostate is not in the scrotum. Prostate अंडकोश में नहीं है, ये बदन में बहुत डीप ब्लैडर के नीचे है, जहां पे ये यूरिनरी पैसेज को सराउंड करता है, और इस तरह से ये इस रास्ते को ऑक्लूड कर सकता है. 40-50 की जो उम्र या दशक होती है, उस समय हार्मोन चेंजेस के द्वारा प्रोस्टेट की चेंजेस होती है. जैसे हार्मोन चेंज होते हैं और हम लेथार्जिक होते हैं, हमारा टेस्टोस्टेरोन कम हो रहा होता है वगैरह वगैरह, वैसे ही प्रोस्टेट एक तरह की चेंज अंडरगो करती है. वो चेंज के बारे में हमें जानना चाहिए. फ्रेंड्स, हम मिथ नंबर 7 को आ रहे हैं. Smoking does not affect kidneys. ये सच नहीं है. It is not true that smoking does not affect kidneys. Smoking is an amazing kind of carcinogenic effect. In fact, tobacco. We have no tobacco day every year, which we not celebrate, but you could use that day as an awareness drive across the world to look at give up tobacco and quit tobacco. So tobacco and smoking do affect kidneys. They affect the male sexual organ. They affect various parts of the body because of the carcinogenicity. Smoking is identified as a major risk factor for the kidneys, for the ureter, for the urinary bladder cancers, and all smokers. Either they are presently smoking or they were smoking in the past, run a risk of cancers of the above organs, at least in urology. They also land up with gastric cancers and nasopharyngeal and oral cancers around because of tobacco. But kidney cancers, ureteric cancer, urinary bladder cancers, and higher propensity of prostate cancers is seen in smokers, both present as well as past. And therefore, if you have been a smoker in the past time, be aware of it. If you are a present smoker, then the only word today will be give up smoking, quit smoking, and you probably would de-escalate your chances, though it will take time, and possibly would then have a watchful waiting in terms of prevention of it. So friends, myth number 7 was smoking does not affect kidneys, which is not true. Smoking या cigarette smoking से आपकी किडनीज को अफेक्ट होते हैं, आपके वेरियस ऑर्गन्स को अफेक्ट होते हैं. लंग कैंसर सबसे कॉमन कैंसर है जो स्मोकिंग से होता है, तो कृपया स्मोकिंग को क्विट करें. टोबैको आपकी ओरल नेजोफेरेंजियल कैंसर्स करती है, लंग्स को अफेक्ट करती है और कार्सिनोजेनिसिटी लाती है. लेकिन यूरोलॉजिकल ऑर्गन्स में किडनी, यूरेटर, यूरिनरी ब्लैडर और प्रोस्टेट कैंसर की प्रोपेंसिटी बहुत हद तक बढ़ जाती है. तो कृपया नो टोबैको डे को अपने ध्यान में रखते हुए quit smoking is a very important day, important aspect to remind you around. Myth number 8, bleeding in urine, जिसे हम हेमाचूरिया कहते हैं, happen because of less water or because of summer season. ये बहुत ही कॉमन myth है. लोग सोचते हैं कि पेशाब में खून जा रहा मतलब हम कम पानी पी रहे हैं, या पेशाब में खून जा रहा बिकॉज ये समर सीजन है, और दोनों में से कोई सच नहीं है. ये और बात है कि आज बहुत से बुजुर्ग, बहुत से लोग कार्डियक बीमारी के कारण एंजियोप्लास्टी कराते हैं और उनको हम लाइफ लॉन्ग ब्लड थिनर्स पे रखते हैं, और ब्लड थिनर्स खाते वक्त कोई छोटी सी भी लीजन है तो यूरिन में ब्लीडिंग हो सकती है. पीपल टुडे आर टेकिंग प्लाविक्स, दे आर टेकिंग इकोस्प्रिन, दे आर टेकिंग ब्रिलिंटा. All these are wonderful, good blood thinners or antiplatelets which help your bloodstream to be thin enough not to have clotting factors for the stents placed by the cardiology colleagues because of angioplasty. और वैसे कंडीशन में अगर आप ब्लड थिनर्स खा रहे हैं और यूरिन में ब्लीडिंग हो रही है और कभी क्लॉट फॉर्म हो रहा है, तो फिर भी यूरोलॉजिस्ट से टाइम पे मिलने की जरूरत है, इससे पहले कि वो इमरजेंसी बने. सो एनी ब्लीडिंग इन यूरिन should not be left lightly. Any bleeding in urine, never. Be it microscopic or macroscopic, जो आपको दिखता है और जो यूरिन रूटीन में माइक्रोस्कोपिकली दिखता है, should never take bleeding in urine lightly at all. Most commonly, hematuria happens because of stones. किडनी स्टोन्स इतनी बड़ी एपिडेमियोलॉजिकल डिजीज है, स्टोन्स मूव करें, स्टोन्स की यूरेटर में आए, स्टोन्स ब्लैडर में हो या कहीं अटक जाए तो ब्लीडिंग हो सकती है. कैंसर्स इन द किडनी, इन द यूरेटर, इन द ब्लैडर, इन द प्रोस्टेट, इन द यूरेथ्रा कैन ब्रिंग अबाउट ब्लीडिंग इन यूरिन एंड सीवियर यूरिनरी इन्फेक्शन, सिस्टाइटिस, सीवियर सिस्टाइटिस, ह्यूमन पायरोवायरस, वायरल इन्फेक्शंस में ब्लैडर में बहुत इन्फेक्शन, ऐसे कंडीशन में ब्लीडिंग हो सकती है. ऑल्सो मैंने जब बताया पेशेंट ब्लड थिनर पे होते हैं, बिकॉज ऑफ दैट देयर कुड बी इंक्रीज रिस्क ऑफ यूरिनरी ब्लीडिंग. तो फ्रेंड्स, ब्लीडिंग इन यूरिन अगर आपने कभी देखा है और उसे अनदेखा किया है तो वेट करें, कभी इमरजेंसी ब्लीडिंग हो सकती है, वो गलत टाइम पर गलत जगह पे हो सकती है. सो एवर यू सी अ माइक्रोस्कोपिक हेमाचूरिया, अ यूरोलॉजिस्ट नीड्स टू टेक इट टू अ लॉजिकल कंक्लूजन इन अ माइक्रोस्कोपिक हेमाचूरिया parlance to identify the causes of microscopic hematuria. It's a nephrological or urological cause. Is it because of stone cancer or a severe urinary infection, which with an examination, evaluation, and talking to you with basic examinations, which include an ultrasound, a CT scan, a urine routine, and dysmorphic RBC pickup on urine test, can probably pick it up. So it's important for us to look into that. कि bleeding in urine and hematuria is not because of summer season या because आप पानी कम पी रहे हैं, ऐसा सच नहीं होता. An important aspect to be awake and aware of. Very important, friends. Let's move forward. Male and female urinary tracts are similar. ये सच नहीं है. Male and female were probably made completely different by God. And when we look at the genitourinary system, it's completely different. For example, males have a common passage for both urinary and sexual health. The urethra is harbored within the male organ called the penis, and therefore the male organ contains the urinary passage from the beginning to the end. The initial part is obviously occupied by prostate, through which the urethra starts from the bladder. But later on, the male organ or the penis, which is an erectile body, harbors the urethra deep inside, obviously ventrally. And therefore, that's one important aspect there. Men need to maintain their hygiene to prevent a urethral infection, because all those who are non-circumcised and have a prepuce need to maintain a hygiene of that part. Women have a completely different structural architecture of a separate urinary and sexual organs. याद रखिएगा, औरतों में यूरिनरी पैसेज जो 4 सेंटीमीटर का यूरिनरी पैसेज होता है वो ब्लैडर से आकर के एक्सटीरियर को खुलता है, कंपेयर टू पुरुषों में जिनमें 18 से 20 सेंटीमीटर की यूरेथ्रा होती है। सो औरतों में जो 4 सेंटीमीटर की यूरेथ्रा होती है, उसके ठीक पीछे वजाइना होता है एज अ फ्रेंडली नेबरहुड, उसके ठीक पीछे रेक्टम होता है एज अ फ्रेंडली नेबरहुड। अदर वर्ड्स, सिर्फ यूरेथ्रा के अंदर और ब्लैडर में बैक्टीरिया नहीं होते, पर वजाइना और रेक्टम में बैक्टीरिया या बैक्टीरिया के स्टोर हाउस होते हैं। सो वजाइनल बैक्टीरिया और रेक्टल बैक्टीरिया जब बाहर आते हैं तो वो इंट्रोइटस को सॉइल करते हैं, और ऐसे बहुत बार यूरिनरी इन्फेक्शन होने की पॉसिबिलिटी होती है। एंड इट्स इंपॉर्टेंट फॉर अस टू देयरफॉर नो दैट hygiene expectation in women is more. They just need to maintain the hygiene of the introitus higher than whatever they do, only because the bacteria are waiting there to enter the urethra and probably colonize, which could happen post-sexual activity, which could happen just because of urethral instrumentation or because of poor hygiene, because of diapers and because of, not changing undergarments frequently, etc., etc. So hygiene for women is almost an innate activity required because of a non-negotiable change of what was gifted to them as a genitourinary organs, where the rectal bacteria and the vaginal bacteria would soil the introitus, from where a sterile organ called the bladder and the urethra can get colonized and contaminated and can get infected, leading to a UTI. And therefore, females have more higher chances of urinary tract infection because of a shorter urethra. The vaginal and the rectum are close by, which are denominators of bacteria closely and probably infecting you. Very important to understand that men and female have different genitourinary system altogether, and therefore their hygiene, their care, and their aspects are completely different altogether. That's how it is the law of nature. Let's go to myth number 10. Incidence of urinary infections are equal for males and females, and that just correlates to what I just spoke on. Women are more prone to urinary infection as a result of their architecture of the urinary and sexual organs. Thus, a continued contamination of the introitus or the external passage, जहां पे एज रिलेटेड चेंज, हार्मोन की चेंजेस जो मेनोपॉज में होता है, उस एरिया को और बिरफ्ट करता है। इससे पहले जब हार्मोन्स बिल्कुल नॉर्मल थे बिटवीन 10s एंड 40s, उस समय वहां एक गार्ड रहता था जिसे हम हार्मोन या फीमेल हार्मोन्स कहते हैं। अब मेनोपॉज के बाद वो हार्मोन हट जाता है, वो एरिया ड्राई हो सकता है, बैक्टीरिया आराम से अंदर जाकर के इन्फेक्ट कर सकते हैं। Therefore, post-menopausal women are more prone to recurrent UTI, partly because the urethra is more easily colonized and probably bacteria can ascend up. Women may not be able to empty the urine completely, partly because of urethral changes and sometimes urethral stenosis and changes happening in that part. So women are more prone to UTI, more during formative and mature years, and also during the adult years and later thereafter geriatric years around. Overall, only because of anatomy and because of hormone changes happening around, and therefore women need to be aware. So recurrent urinary tract infection always has a cause, and therefore your urologist will tell you to actually pick up these things. And I get to see women who have recurrent urinary infection so common. So commonly we were treating the bacteria in the urine, which is not required. You got to give a proper urine sample. And what is a proper urine sample? Clean the introitus very well. नीचे की पार्ट को अच्छे से वॉश कर लें। यूरिन पास करना शुरू किया तो पहला यूरिन छोड़ के बीच का पेशाब इस तरह बॉटल में दे, और वही हम यूरिन की सैंपल बोलते हैं। यूरिन का सैंपल वो ना हो जो हर समय सुबह 6 बजे देना पड़े और बॉडी से निकलते और पहला सैंपल, वो गलत है। बहुत बार हम डॉक्टर शायद आपको बता नहीं पाते कि यूरिन का सैंपल कैसे देना है, पर देने का तरीका यही होता है कि नीचे के पार्ट को अच्छे से वॉश कर लिया, या पुरुषों में स्किन को पीछे करके अच्छे से वॉश किया, बिकॉज वहां कंटामिनेशन है। सो टिप ऑफ द पेनिस एंड टिप ऑफ द यूरेथ्रा ऑलवेज कंटामिनेटेड, एंड देयरफॉर दे नीड टू बी क्लीन एंड वॉश वेरी वेल। पहली पार्ट ऑफ यूरिन को छोड़ करके बीच का जो पार्ट आ रहा है वॉश करने के बाद उसे बॉटल में दें, बिना ऑर्गन को टच किए, बिना बॉटल को टच किए। अगर आपने ये दिया है तो कोई जरूरी नहीं कि सुबह 6 बजे या 9 बजे देना, 10, 12, 4 बजे भी दे सकते हैं आप, जब आपने डॉक्टर को दिखाया है। उसके बाद वो आपको सैंपल देने को बोलेंगे और तभी आपकी ट्रीटमेंट सिम्प्टोमेटिक केयर में आ पाएगी। So friends, women are more prone to urinary infection, and we need to look at nipping it in the bud, identifying the causes, looking at hygiene as an aspect of care which they need to be reinforced. Not that they don't do, they maintain it very well. And look at various aspects of recurrent urinary tract infection in young women, as honeymoon cystitis, and elderly women who have got postmenopausal changes and probably urethral blockages, which could be metal stenosis and urethral stricture. Very, very important aspect which is missed out. And rather than just treating them with bacteria, a urinary test, which is sometimes wrong, and then probably giving antibiotics and treating them again and again. And therefore, recurrent UTI does not always require antibiotics. It requires that we identify the cause of recurrent UTI. Very, very important. We miss that out, and that happens to be a myth number 10. Let's go to myth number 11. Production of urine is same during the day and night. Not true. Not necessarily true. Therefore, there's a term called nocturnal polyuria. There's also a term called global polyuria. Polyuria is excessive urine production. बहुत ज्यादा पानी पिएंगे तो बहुत ज्यादा पेशाब बनेगा. Body does not require more water than it wants. Therefore, if you give extra water, which is helpful, keeps you well hydrated. Then the extra water is removed from the kidneys, which handles good amount of water every day. So if you added a liter or 2 extra liters of water inside the body, the kidney will filter it out from the system and therefore maintain a homeostasis. Our kidneys are very efficient systems around that take care of the kidneys thoroughly well. In taking care of kidneys, excess amount of water is removed all the time. Elderly people have got a milder sleep at night, a lesser sleep at night all the time, and they produce more urine at night. It's because of changes happening in the arginine vasopressin system. Therefore, the production of urine is more at night in the elderly people, and that is called as nocturnal polyuria. Nocturia is a term where you get up multiple times to pass urine. It could be happening because of umpteen reasons, right? From diabetes to cardiac diseases to drinking lots of water to being awake. Nocturia can happen multiple reasons. But nocturnal polyuria, or production of more urine at night, can happen in diabetics, can happen in elderly people, can also happen in children who actually don't get up but actually do bedwetting. So that's important aspect of it. So production of urine may not always be same during the day and night. Number one. Number two, global polyuria is a term which is utilized more for people who drink day and night, and also for diabetic individuals who produce a lot of urine all through the day and night. They're seen more happening in the night actually. So production of urine in elderly or geriatric individuals sometimes can be more than 1/3 of total production of urine in the 24 hours, and that is called as nocturnal polyuria. That means more than 33% of the entire urine produced in 24 hours could actually be produced at night, called nocturnal polyuria, and that leads to you getting a multiple times a night. If there's a nocturnal polyuria, that means you produce so much urine at night, you may have to get up multiple times. याद रखें, बुजुर्गों में और जेरियाट्रिक एज को में हमारे फादर मदर और हमारे ग्रैंडफादर मदर की उम्र में रात को यूरिन की प्रोडक्शन ज्यादा होती है. ये बहुत कॉमन है, जिसे हम नॉक्ट्यूरिया कहते हैं. इसकी ट्रीटमेंट अवेलेबल है, बशर्ते हम लोगों ने कंप्लेन किया और सही यूरोलॉजिस्ट को जाकर के दिखाया. ये बहुत जरूरी है कि यूरोलॉजिस्ट आपके इस हेल्थ में बहुत इंटरेस्टेड है. तो हम कोकिलाबेन धीरूभाई अंबानी हॉस्पिटल में, जहां नॉक्ट्यूरिया और बेडवेटिंग की क्लिनिक डिपार्टमेंट ऑफ यूरोलॉजी में चलती है, सेकंड फ्लोर में, मंडे टू सैटरडे. इंपॉर्टेंट है आपको जगाना कि नॉक्ट्यूरिया एंड बेडवेटिंग आर कंप्लीटली क्योरेबल. ये इंपॉर्टेंट है कि हम लोगों को आवाज दें, उनको जगाएं कि रात को अगर यूरिन बार बार जाना पड़ रहा है तो क्यों जाना पड़ रहा है, या आप रात भर बहुत ज्यादा पानी पी रहे हैं या चाय कॉफी अल्कोहल ले रहे हैं, जो बेवरेजेस हैं जो किडनी को अटैक करती हैं और किडनी को हैमर करती हैं कि ज्यादा यूरिन बना. तो ये बहुत इंपॉर्टेंट है. तो खाने पीने में 2 घंटे की जो 3 घंटे की गैप हम रात को कहते हैं, हम कहते हैं रात को अपनी पानी कम कर दीजिए, बशर्ते आपने दिन में अच्छा खासा पानी पिया कि आपकी सिस्टम वेल हाइड्रेटेड है. ये सब बहुत इंपॉर्टेंट एस्पेक्ट है, बिकॉज रात को यूरिन की प्रोडक्शन उम्र के साथ साथ 50-60 साल के बाद बढ़ जाती है, और जब बढ़ जाती है तो रात को बार बार उठना पड़ता है. नहीं उठे तो शायद बेडवेटिंग भी हो जाएगी, पर उठना पड़ता है तो आपकी वो दिनचर्या खराब हो जाती है, बिकॉज रात को आप जगे रह गए. और बहुत बार बुजुर्गों में रात को नींद नहीं होती, और अगर नींद खुली तो उसके बाद फिर dawn तक नींद नहीं आता है. It's important for us to wake up that geriatric individuals, our parents and our grandparents who get up multiple times and who have got issues with arthritis and with walking and moving and movement disorders. We don't want them to fall down. Nocturia is a very silent menace. It's only you who can make a difference. If you identify nocturia, I'm very keen to help nocturia and nocturnal patients get prevented from this aspect of a kind of an issue that they go through. Nocturia is identifiable, treatable, curable. So why ignore it and keep it underdiagnosed, undertreated, and underreported completely? रात को बार बार यूरिन जाना अपने में एक तरह की बीमारी बन जाती है, जिसमें हम जगे रहते हैं पूरी रात यूरिन पास करने के लिए. तो उसकी जो पूरी ढांचा है, जिसे हम बिहेवियरल थेरेपी और फार्माकोलॉजिकल थेरेपी में ठीक करते हैं, वो ठीक करना बहुत जरूरी है. As a bedwetting clinic, as a nocturnal clinic, which was the first of one of its kind as a combined clinic set up in the country 6 years ago at the Kokilaben Hospital and Department of Urology, we are interested in helping individuals who have got nocturia, who have got bedwetting. So very important, friends, that production of urine is not same during day and night. It could possibly be very different at times. Myth number 13. We wanted to go to myth number 12. So myth number 12 is about bedwetting. That means bedwetting is not always curable on its own. Many times parents leave these children between 6 to 15 years. I'm missing out the myth number 12, but let me just pronounce it. It was related to nocturia, and therefore let's talk about it. Bedwetting is not always spontaneously curable. अगर कोई ऐसा बच्चा है जिसको 6 साल से 15 साल की उम्र है और वो रात को हर रात या हफ्ते में 1 बार 2 बार या रात को 2 बार बेटिंग करता है, तो इसे छोड़ देना अच्छी बात नहीं है कि अपने आप ही ठीक हो जाएगा. ये उसकी मोरल को डाउन करता है. वो 2 बार बेटिंग करता है, वो घर में डांट सुनता है, उसकी नींद खुली रहती है, बहुत बार जग जाता है, और उसकी परफॉर्मेंस स्कूल में इतनी अच्छी नहीं रहती है. इट इज इंपॉर्टेंट फॉर अस टू हेल्प दैट bedwetting is not always spontaneously curable. There's a large subset of children who may not get cured, and they may land up into adolescents and adults as bedwetting children and bedwetting adults. It is important for us to identify children between 6 to 15 years. और कोई भी ऐसा बच्चा है जो 6 से 15 साल की उम्र में अगर बेडवेटिंग कर रहा है, तो उनके पेरेंट्स, उनकी माताओं के लिए बहुत जरूरी है कि हम अपने बेडवेटिंग क्लिनिक को जाएं। हम कोकिलाबेन धीरूभाई अंबानी हॉस्पिटल पे सेकंड फ्लोर डिपार्टमेंट ऑफ यूरोलॉजी में बेड वेटिंग को बहुत अहमियत देते हैं। बच्चे जो 6 से 15 साल की उम्र में हैं और जिनको रात को 1 बार से 2 बार यूरिन पास करना पड़ता है, वो हर दिन हो या हफ्ते में 1 बार 2 बार या महीने में 2-3 बार भी हो, हमारे जरूरी है कि उसको हम बिल्कुल थामें, उसकी हम क्योर लाएं। और उसकी क्योर बहुत हद तक बिहेवियरल थेरेपी, बहुत हद तक अलार्म थेरेपी और फार्माकोलॉजिकल थेरेपी में होती है। तो कोई भी ऐसा बच्चा है जो 6 साल से 15 साल का है, ऐसा ना सोचे कि मिथ नंबर 12 जिसमें उनकी स्पॉन्टेनियस क्योर अपने आप ही हो जाएगी जैसे उम्र बढ़ती बढ़ती, ये सच नहीं। मिथ नंबर 13 जो मैं अभी प्रोजेक्ट कर रहा हूं, किडनी स्टोन फॉर्मेशन इज रिलेटेड टू ईटिंग सीडी वेजिटेबल्स, बीज वाले वेजिटेबल्स और फ्रूट्स खाने से होता है, जैसे टोमेटो, गुआवा और लेडीज फिंगर। ये सच नहीं है। हम टोमेटो, गुआवा और लेडीज फिंगर खाते हैं तो हमारे स्टोन बन जाते हैं, ऐसा नहीं है। उनके सीड्स पत्थर नहीं बनाते। सो किडनी स्टोन्स एक्चुअली आर नॉट द सीड्स व्हिच यू ईट. The seeds which you eat are undigestible form and they're passed in motion. They don't go to urine. Kidney stones are concretions. They're concretions and they form due to excessive amount of solutes in urine that are not dissolved. And they progress to grow and obstruct the urinary passage, namely the ureters. Now, stones are not made of seeds, but aggregation of oxalate, calcium, uric acid, phosphates in the background of perhaps less amount of water. तो ये माने कि टमाटर खाने से, भिंडी खाने से और अमरूद खाने से पत्थर नहीं बनता, उनके सीड्स पत्थर नहीं बनाता, तो सीडी वेजिटेबल से पत्थर नहीं बनता। ये बहुत ही बड़ी मिथ्या है इस देश में, और हम मंडे टू सैटरडे ये आंसर करते हैं अपने स्टोन फॉर्मर्स को। ये स्टोन एक कंक्रीशन है जो किडनी एक तरह की सुपर सैचुरेटेड यूरिन को फिर डिजोल्व नहीं कर पाती। तो किडनी अपने यूरिन को, ब्लड को प्यूरिफाई करती है, और जितने भी एक्सेसिव अमाउंट ऑफ कैल्शियम, ऑक्सलेट, यूरिक एसिड, फॉस्फेट, ये सब कुछ जो ब्लड में है, फॉर्म हो रहा है, एक्सेसिवली इनटेक किया गया है, वो सारा कुछ ब्लड से निकाल के किडनी में लाती है। लेकिन किडनी में उससे डिजोल्व होकर के पास करने की जरूरत है, बिकॉज यूरिन एक लिक्विड तरह की तरल पदार्थ है और उसे खाली करना है, और वो उस समय हो नहीं पाता। इसलिए नहीं हो पाता कि शायद हम कम पानी पीते हैं, रात को हम कम पानी पी के सोना चाहते हैं बिकॉज हम रात को उठना नहीं चाहते। लेकिन याद रखिएगा, स्टोन फॉर्मर्स के लिए ये बहुत इंपॉर्टेंट संदेश है कि अगर हम रात को कम पानी पीते हैं, हम अपने किडनीज को वो टॉर्चर करते हैं जिसमें रात 10 से लेकर सुबह 6 तक हम सोना चाहते हैं, खराटे लेना चाहते हैं, और उसके बाद हम व्हाट्सएप करना चाहते हैं। लेकिन 10 से 6 के बीच में हमारी किडनी सफर करती है, उसे यूरिन तो बनाना ही बनाना है। जो यूरिन उस समय बनता है वो अनफॉर्चुनेटली बहुत कंसेंट्रेटेड होता है, और कंसेंट्रेटेड यूरिन में तो स्टोन ही बन सकता है, बिकॉज उनकी डिसोल्यूशन पावर बहुत कम रहती है। तो याद रखें, फॉर ऑल स्टोन फॉर्मर्स एटलीस्ट, and it's important that we divide our water intake across the day and night. We can drink water before principal meal so that we are hydrated well, rather than drinking only sips of it because not much is left over in our tummy after having a sumptuous meal. So drink water before and after principal meal, divide it across the day and the night, and drink water at night before you go to sleep as a stone former. Get up at night and see there are no thieves anywhere, and drink some more water so that your kidneys get good amount of water for them to actually be well hydrated and the urine becoming undersaturated for them to not form stones. We are lucky if we are not cardiological patients or nephrological patients, because our cardiologists and nephrologists would then not stop our water intake across the day and night, and that is a very important aspect to wake up. So in kidney stones don't form because of seedy vegetables like tomato, guava, and lady's finger. Friends, very important. Coming to the last myth of the day, all girls are born with uterus and vagina. That's a myth. That's an important myth, and therefore I kept it to the last. Remember, there is a syndrome called as MRKH syndrome. MRKH, Mayer-Rokitansky-Kuster-Hauser. 4 different scientists who worked very hard at 4 different points in time. 160 papers and research articles brought about identification of a century-old issue where perhaps God forgot to actually distribute the right organs to the right individuals called women. Don't forget that MRKH syndrome is a part of the Rare Disease Day, which we make aware or celebrate on the last day of February. The last day of every February is the Rare Disease Day, and MRKH syndrome goes into the Rare Disease Day, where 1 in 4,000 to 5,000 women are born without a uterus or a vagina or both, a congenital condition. Therefore, 1 in 4,000 to 5,000 women is a very, very common condition rather than a rare condition. Now, this may not be diagnosed at birth because it's not a male child. It's a female child, and the organs of uterus and the vagina are internal. They may not be visible till a point in time in adolescence when it's time for her to have menstrual periods, which sadly get delayed or are absent. And from the age of 12 to 14 years, when she should have a menstrual period, she doesn't have menstrual periods. Parents perhaps will forget or may wait for it to happen. And after 12, 14, 16 years, they'll end up going to a gynecologist and getting ultrasound done. And that's the time we see that the uterus is rudimentary or picked up by a observer-dependent investigation called a sonography as a rudimentary uterus, and the vagina perhaps is not visible because it can't be visualized as a hollow structure. And that's where they wake up to a phenomenon and go to gynecologist, but there's not much respite. In other words, the uterus, if rudimentary picked up on ultrasound, also is almost an absent uterus because it cannot grow. MRK syndrome is almost near complete absence of the Mullerian structures which bring about the growth of the uterus and the upper third of the vagina. So friends, cure to them is when they are needy, and the needy are those who are anything between 12 years plus. That's the age when we pick up. We don't pick up when they are born. So at the time, either you will give them a uterine transplant, which costs 25 to 30 lakh rupees, only to have a childbirth, and then again, probably remove the uterus and do everything by cesarean section, do a surgery for them, and obviously go through a very complex procedure. And from where does the uterus come? From the aunties and from the mothers around. Are they capable enough to actually get it sorted out? Instead, women whom I continue to see from the age of 12, 14 years to 25, 30 years in whom it has been missed and who have been going around attempting to get their correction happening, which was missed out when they were born and the distribution of organs was happening, is by creating a new vagina. New vagina is a new vagina which we create around, and that is done by sigmoid vaginoplasty. Sigmoid is an intestinal segment, a redundant segment, which is the last part of the colon, where we can actually create a flap of that between 12 to 15 centimeters of an adult organ created. And at Kokilaben, Dhirubhai, Ambani Hospital, from an open surgery to a robotic surgery, we have gone deep into reconstruction, where we have brought about a robotic sigmoid vaginoplasty as a creation of a new vagina for women who are born with absence of vagina and the uterus as a result of MRK syndrome. Friends, सर समझाने के लिए MRK syndrome वो है जो बचपन में पकड़ में नहीं आता. वो पकड़ तब आता है जब मेंस्ट्रुअल पीरियड्स होने का टाइम हो गया 12 से 14 साल और उसमें मेंस्ट्रुअल पीरियड्स नहीं हो रहा है. उस समय अगर एक लड़की में मेंस्ट्रुअल पीरियड्स नहीं हो रहा और हम उस समय चेकअप कराते हैं और सोनोग्राफी कराते हैं तो पता चलता है यूट्रस बहुत छोटी है, वजाइना एब्सेंट है, और यूट्रस और वजाइना का न होना उस समय उसके बाद नहीं हो सकता बिकॉज ये ऑर्गन्स डेवलप नहीं हुए. तो कहीं ना कहीं मुलेरियन स्ट्रक्चर्स का डेवलप ना होना फिर डेवलप नहीं हो पाता. इन लड़कियों में फिर मेंस्ट्रुअल पीरियड्स नहीं हो सकता. और ऐसे कंडीशन में उनको क्योर लाने के लिए, उनको पूरा औरत बनाने के लिए, ताकि उनकी दाम्पत्य जीवन और उनकी फ्यूचर सेफगार्ड हो सके, बहुत इंपॉर्टेंट है. याद रखें, ओवरीज वो स्ट्रक्चर है जैसे पुरुषों में टेस्टिस है, वैसे औरतों में ओवरीज होता है जो हार्मोन्स की देख रेख करती है. और इस देख रेख में वो औरतों को वो सारे हार्मोन्स देती है लड़कियों को, जिससे उनकी पूरी सेकेंडरी सेक्सुअल कैरेक्टर्स और उनकी बॉडी का ढांचा बिल्कुल औरतों ऐसा लगता है. उनकी बातचीत, उनका चाल ढाल, उनकी आवाज, सब कुछ औरतों की होती है. तो आप औरतों को पहचान नहीं पाएंगे जिनमें MRK सिंड्रोम या उनकी यूट्रस और वजाना में से ही. सो इसलिए लड़कियों में बिकॉज ऑफ ओवरीज और ओवरीज में ओवा, हम ऐसी कंडीशन में अगर न्यू वजाइना बनाते हैं जिसमें एक वजाइना होता है और दंपति जीवन अच्छी मेंटेन हो सकती है, तो हम सरोगेट प्रेगनेंसी या सरोगेसी के द्वारा इन विट्रो फर्टिलाइजेशन के द्वारा ओवा लेकर के और IVF कर सकते हैं. सो फ्रेंड्स, 12 से 14 साल में अगर कोई लड़की है और उसकी मेंस्ट्रुअल पीरियड्स नहीं हो रही है, तो इसका मतलब ये है कि हम चौकन्ने हो जाएं कि ऐसे कंडीशन में हम सोनोग्राफी करें और उसके बाद MRI के लिए जाएं. और ऐसे कंडीशंस की ट्रीटमेंट हम आज कोकिलाबेन धीरूभाई अंबानी हॉस्पिटल में वजाइनोप्लास्टी के द्वारा करते हैं. वो वजाइनोप्लास्टी जो एक एडल्ट ऑर्गन है, वो ऑर्गन नहीं जिसमें हमने कुछ थोड़ी बहुत स्किन ग्राफ्टिंग कर दी और छोटा सा पिट बनाया, बट वो ऑर्गन जो एक्चुअली एक एडल्ट औरत को या एडल्ट लड़की को केपेबल बनाता है कि अपनी दाम्पत्य जीवन में कोई मुश्किल न होने पाए, और इसे हम नियो वजाइना कहते हैं. ये हमने कुछ दूसरे वीडियोस में इसकी जागरूकता को बहुत ऊंचे लेवल तक ली है, लेकिन आज टू मेक पीपल अवेयर ऑन MRK syndrome, where it is a myth that all the girls are born without uterus and vagina, which is true, that the girls are born without uterus and vagina in 1 in 4,000 to 5,000 individual, because MRK syndrome very much has come to stay after the 4 important scientists in Europe worked very hard to diagnose this condition and give it an entity. So friends, if there are girls and women who have no menstrual periods, they've got absent uterus and vagina, they could have a new vagina, they could have a good sexual life and could get married, and thereafter in a good understanding between them and their partner, they could have an in vitro fertilization, and they could be a complete woman both in their married life as well as being able to deliver a child, rather than going for a uterine transplantation which costs close to 20-25 lakhs, whose results are still awaited. which could still be in infancy even after a decade after the uterine transplantation has been brought into fore. Who would actually give the uterus? Is the uterus capable of holding the pregnancy? And is the uterus to be removed after that because it requires that immunosuppression, etc., etc.? Are the large Pandora's box we need to open. So, friends, from myth number 1, in terms of kidneys, where they're not necessarily everybody is born with 2 kidneys, 2, the kidney being not affected or affected by diabetes mellitus and hypertension. 2, kidneys are affected by smoking. 2, important for us to know that the kidney stones are not formed because of seedy vegetables. 2, it's important that diabetes and blood pressure affect kidneys. And to also look at that nocturia or getting up multiple times at night happens more in elderly people, more in diabetics who actually produce more urine at night, called nocturia. And to looking at that bedwetting not necessarily will be spontaneously curable. It's today morning I saw a 21 years young girl and a 27 years young lady who are still bedwetting after 10 to 15 years of their memory कि bedwetting खत्म ही नहीं हुई, हमने इतनी सारी treatment की थी. So it's important to treat everything in time. Like we identify women between 12 to 14 years who don't have got menstrual periods. अगर menstrual periods 12 से 15 साल में नहीं हो रहे हैं तो कहीं ना कहीं कुछ miss हो रहा है. We need to identify that. Friends, these myths are to shatter, and therefore they are shattered today by you identifying that and knowing that these myths are not to stay anymore. It is important for us to take this forward to the next level of awareness. Friends, in urology, which the subject which has gone to very high levels, it is important for us to go to the next level. In other words, awareness, awareness, and awareness is a key to a great management. And while doing so, it is important for us to do a management which is completely a teamwork, a dream teamwork, which I continue to do from the offices of the Kokilaben Dhirubhai Ambani Hospital and Department of Urology with our colleagues in urology. But I look forward to this going to the society. More and more people understanding and identifying it will help our dream come true, where we shatter the myths, bring urology health with its revolution to the front row seat, and implement it, which truly is a challenge. Let's not postpone this challenge to the next level completely. Friends, thank you for coming on board for this very important aspect of identifying that there are so many myths in society and which have actually made a deep ingrained into society. We need to wake up to this phenomena, and we need to spread this information that people wake up that these myths need to be shattered completely. Thank you so much.